In general, the big things that we harp on by pretty much every provider in clinic is making sure we're, not constipated, because constipation has a big effect on how kids urinate during the day and even at night as well. Making sure we don't hold our urine for too long. Holding urine for, the extent of the day, especially during school days, is not a good idea. And making sure we empty frequently, so on pretty much a time schedule. Those are the tenets of what we call bowel and bladder management. Another thing we try to do is avoid dietary triggers. Most of the stuff we know is not good for kids. So coffee, teas, sodas, things with a lot of caffeine. And then we try to stay away from things that are spicy food. They're known to kind of cause, the bladder to be a little bit more overactive and may lead to some urinary symptoms and simply identifying that in the diet and excluding those things can often help kids. In most schools, by far and large, when kids need to go to the bathroom, they're able to go to the bathroom on their own. However, there's a handful of kids that come in where they get disciplined for needing to go to the bathroom. And so in those situations, we kind of write letters to the school, work with schools and counselors to get them to make sure that they optimize their urinary health so they don't run into problems early on, and then that'll set them up for good bladder habits later on in life.